though. You will have heard the last couple of ads. We've mentioned the fact that we have an interactive lounge up and running at the moment for anyone with a query about bowel cancer. You've heard the stats. South Australia's second most common cancer. It's very treatable if found in the early stages. So the idea for today with Cancer Council SA and indeed FIVEaa is a pretty simple one. Call in, have a chat with our nurses. They're in the next room. It's all very private, confidential. The number is 8419 1473. Give them a call if you've got any question. Doesn't matter how silly. It's worth calling in. And, as I say, entirely confidential. It's worth your time. People will perhaps know that we've experienced bowel cancer in my family, and that's just not an uncommon tale. The problem, though, and to some degree I think is men are worse at this, it's that with the bowel, it's not wonderful to talk about necessarily all the things that do go with that. And you know what? How silly is that? How silly and tragic is it to think that some cases might be being missed, or people aren't going and asking questions, aren't ringing our interactive lounge today because it's a little bit embarrassing. How crazy is that when you think about what you can gain and what you can lose? 8419 1473 is the number. Louise Bond is a Cancer Council ambassador. Louise, good afternoon to you. Thank you for coming in.
Pleasure, Will. Pleased to meet you.
2009, you were diagnosed with bowel cancer.
Yes, went to work feeling perfectly normal one day. That night, felt a bit achy that night, like I was going to get the flu, and I thought, I haven't got time for this. Took a couple of Panadol, went to bed and still woke up achy, went to work. But by lunchtime, I had a pain in my back, and I knew instinctively it wasn't a normal pulled muscle or bruise type pain. So by lunchtime, I could hardly stand up. So I took myself home, went to the doctor. He sent me off for a scan. And a few weeks later, went in to see the liver surgeon because I'd found some spots on my liver. The liver surgeon said, we've also found some nasty spots on your bowel. And as soon as he said that, I knew I was in trouble, big trouble. And then I was sent off to a colorectal surgeon. And by that point in my life, it felt out of control already because I'd been told to go see this doctor, go and see that doctor, go and have this blood test, go and have that scan. And I had to stop work.
And you're not that old.
I was 47 when I was diagnosed, and it was bowel cancer, hadn't even crossed my mind. Even the first scan, like there were spots on my liver, the surgeon said it could have been enlarged blood vessels, and that was needed to be treated with surgery, but he had to find out exactly what it was to know how to treat them. And still hadn't thought about bowel cancer. I'd had hemorrhoids. We can talk about this.
I think we have to. I think for the duration of this discussion, we need to say, listen, queasy people, this is what it's all about. You've got to have these conversations.
You do, and it's not one of those things I would have talked about 5 years ago, but the hemorrhoids were there, and I thought, I haven't got time to deal with that. I had 2 young children, had a job. Yeah. I'll deal with that when I've got more time. And I don't know when that was going to happen. But yeah, as soon as I was told there were nasty spots on the bowel, I knew. So then I was on another roller coaster of seeing another doctor, and then the 2 surgeons and a oncologist then got together to plan how to tackle me, because obviously there was bowel and liver tumours. And so, yeah, my life was in their hands.
When you said it was a unique pain, you knew something instinctively was wrong. A lot of people often think, I wonder what that sign is, because we dismiss so much of it. You hear stories of people dismissing it. You knew in that moment, and did it make you suddenly think of maybe other things that you'd felt and experienced?
What I originally thought was because it was about May, I think, when I first had this pain, May, June, I thought I've been enjoying a bit much Christmas and a bit much Easter.
Right.
I was enjoying some pretty good food, and I thought, the gallbladder's sending me messages. But the GP that I went to initially said, no, the pain's not quite in the right place for that. So that's why he sent me off for a scan. And, there were 2 large spots on my liver. But, the surgeon thought, enlarged blood vessel, or there's another thing he thought it might have been. Yeah. And that surgery would fix that. And even at that point, he was talking about removing 2/3 of my liver.
Oh, wow.
Which was a daunting thought because I've never had any surgery before. So, it was all new, all quite scary. And I never thought I'd be a candidate for bowel cancer. There was no history of it in my family.
Really?
No.
None whatsoever?
No. So it was the furthest thing from my mind.
Well, that's an important message for people, isn't it? That just
Absolutely.
because you don't satisfy traditional risk factors doesn't mean you're out of the woods.
No, not at all. The signs were there, as I said. I had some hemorrhoids, but just assumed that's having had children. It's not uncommon.
Yeah.
But it's not something that's normal either.
Yeah.
So, in hindsight, which is wonderful, should have had that seen to, and then perhaps I wouldn't be where I am now. But having said that, 5 years down the track, I'm in pretty good shape.
You look terrific.
Thank you.
What happened? Because I imagine having cancer in two locations, they were probably saying some pretty scary things to you.
Yep. The first oncologist I went to was fairly blunt, I suppose, gentle in his voice, but the message was pretty blunt. He just said, it's stage 4 and you've got 2 to 5 years and you'll be on chemo for the rest of your life. So at that point, I think I could probably quite easily say I was depressed.
Yeah.
It was a very physical feeling of, I felt like I was in a hole, the pressure on my chest, and I thought, this is it, my life's over. Because I thought of that 2 to 5 years, I'm going to be winding down to a certain extent. So your mind's just racing, and all the things you think you want to do, you think your life's over, all the dreams you had, like work-wise, family-wise, recreation-wise, hobby-wise, everything just goes out the window. And so the next step for me, when I saw my surgeon, my bowel surgeon, he asked me how I got on with the oncologist and said, or when I told him that, I was told, 2 to 5 years chemo, he said, no, that's not how it is. He said, you should do chemo for 6 months, see what happens. Our aim is to cure you. And I can still hear him saying that.
Yeah.
It turned my headset around completely. And I thought, okay. And then I saw my naturopath. I'd been seeing her for a little while, and she said, no, change oncologists, and recommended a lady to me. And, we've gone ahead in leaps and bounds.
And we were speaking off air a moment ago, and you are riding extraordinary distances, which you never did in the past, on a bike.
I would call myself not athletic. I was just an average person, went to work, did all those things. But as I said at the beginning, my life felt very much out of control because it was doctors telling me where I had to go and where I had to be all the time and what had to be done to me. 2 things I did that sort of gave me some control back, and one of them was getting a naturopath on board. And through a good friend and Google, I found a naturopath that suited me, and she's been wonderful. And then also the other thing was my friend who had been through the cancer journey as well, and really impressed the importance of resistance exercise. Yeah. And I couldn't think beyond the gym. So
God forbid, the gym. It's a horrible
It's just
thought,
not for me. And I think the lesson here is you need to find something that floats your boat. For me, the gym definitely doesn't do it. So the first 12 months after diagnosis was 2 lots of surgery, 6 months of chemo, and then started feeling better. And I hopped on my husband's bike one day just to go down to our letterbox, which is about a kilometre away. Rode down the hill, got the mail, came back and couldn't quite make it up the hill, but it was a nice sunny day. I'd been indoors for best of 12 months and it just felt fabulous. It was a real wow feeling, and I thought, this is what I have to do. So straight away when I got home, rang a friend who lives in Victoria but knew where I'd be riding and said, what sort of bike do I need? I knew nothing about bikes.
Wow.
So I thought, dirt roads, because we're out in the country where the cars go 110 along the roads, if not faster, and we've got semis going past. I thought I'll stick to the dirt roads. So with a friend's help, bought a mountain bike and started building up to sort of 10Ks, 20Ks. And at that point I thought, well, if I can do 20Ks on the dirt road, I should be able to do 30Ks in the Tour Down Under. Yeah. So I registered for Ride for a Reason in the Tour Down Under, got a friend to drive over the course with me, and so I could see what I was in for, and I thought, this is not too unfamiliar, not too different from what I ride at home, and borrowed a friend's road bike, and I was hooked. I had an absolute ball on the Tour Down Under. The atmosphere was fabulous, and for me to ride 30 kilometres, and this was in between chemo sessions as well. Wow. So it was just the biggest buzz that I'd ever had, I think, and it felt normal, it felt good. And then after that, stopped the heavy duty chemo, just did like a maintenance dose of chemo for another 12 months, and gradually build up my distances. And then, I now ride around 100 to 150 Ks a week.
I don't even drive that far.
Yeah, I had to get a road bike. So it becomes a bit addictive.
Yeah.
But, a great addiction.
It's a good habit to have.
Yeah, and I love riding. I live at Mannum, so I ride along the river, which is just therapeutic physically and mentally. And my doctors, I still see two of my doctors, and they say don't stop the cycling. It's got dividends in terms of my health, physical and mental. There is research that will support the benefits of resistance exercise for cancer patients. And I remember friends saying to me, like, even when you're in hospital, like if you just get a soft drink can and do some bicep curls, even at that point, I wasn't desperate enough. I still found it boring to do repetitive stuff. And so, when I got on the bike, it was just, this is it. This is what I need to do, and I love it. So through cycling, I've met a lot of wonderful people. It's a very supportive sport that you can participate in from a very recreational level to quite elite level. So you sort of fit in wherever your ability is. So, it keeps me in a good headspace when I'm feeling a little bit out of sorts, which happens occasionally, particularly just before a scan. I'm still closely monitored. Then, hop on the bike. A couple of hours later, the endorphins have kicked in, and your problems don't seem quite so daunting.
Louise, I can see in the room next to us our Cancer Council SA nurses are fielding calls at the moment on the number 84191473. When I say it all sounds like a bit of bland kitsch cliche, but what's your message to the people that are listening about ringing in, about calling in and just asking a question of our nurses that we have on hand?
It's a journey that I don't think you can do on your own, or not easily anyway. I mean, it's not an easy journey, even with support. But the counsellors at the Cancer Council are fabulous people. And I would say, as a patient or as a friend or family member of someone with cancer, there are a lot of questions, particularly early days, and to be able to talk to someone who's been through it, and the Cancer Council does have a service where you can talk with people who have been through your particular cancer, or if you've got questions about your diagnosis, your prognosis, or medications, side effects, you can talk to a Cancer Council nurse, and they've got the answers. So it helps to remove that isolation feeling, because certainly when I was diagnosed, I thought I was on my own. There was no one in my family that had been through bowel cancer, certainly none of my friends. And
Dad was exactly the same. You kind of feel like, well, there's no one else in the world. I mean, we know of it. You hear stats, but it doesn't help you if you don't know anyone in your immediate area, does it?
And you think, and when you hear sometimes people talking about it, like today, you think, oh, that's what happens to someone else. And I can still remember a friend of mine going past me years ago and said something about Relay for Life, which is one of the Cancer Council fundraising initiatives, and gave me a brochure, and I just put it aside. Didn't think anything more of it, because I thought, oh, that's something that happens to old people or people in a risk group, just thought nothing more of it. So tossed it away, and here I am now, cancer survivor. So it can happen to anyone.
Louise Bond, thank you very much for coming in. Wonderful speaking with you, and you do a terrific job, and it's great to see you doing so well.
Yeah, pleasure. Thank you.